Hey, Mama. If you're expecting a baby, you've probably been told that your prenatal appointments, your ultrasounds, your lab work are monitoring everything most important for your child's development. But what if I told you that the most critical system for their lifelong health, their nervous system, actually starts developing all the way back just 3 to 4 weeks into pregnancy? This is before most women even know they're pregnant, and unfortunately, it's one of the things that prenatal care never really measures or addresses. What is even more shocking is that your umbilical cord that's connecting to your baby is actually your key stress and emotional attachment point. Yes, it's carrying nutrients. Yes, it's carrying oxygen, but it's also connecting your state. If you're feeling nervous, anxious, worried, or if you're feeling happy, upbeat, and energized, the emotional state of you creates chemicals in your body and hormones that can go to baby through the umbilical cord as well. So, in this video, I want to share briefly with you one test that we feel all pregnant women should add to their regimen of preparing for delivering a baby. It's something that we did with my wife and something that we do all the time with all the pregnant women in our office. So, this test is called heart rate variability, and I'm going to show you this here in a moment. But before we discuss this, I just want to expand a little bit about your nervous system state affecting baby. Studies have shown for a long time now that the more regulated your nervous system is, the more baby's nervous system is regulated. They use this study, this heart rate variability study, to measure overall stress states, and they're developing technology to be able to measure things earlier and earlier in utero. And what they find is that now that they're able to monitor developing baby, the fetus, earlier and earlier, they're finding a direct correlation with the the healthier the baby's nervous system is correlates directly to how healthy mom's nervous system is. What they find is that if mom is under stress, if they're worried, anxious, maybe they've got work deadlines, maybe relationship isn't going that well, maybe they already have 3 kids at home and they're burnt out going solid, what that does is it depletes their own nervous system, their own battery, and they can actually measure a direct correlation to baby's nervous system. The other really cool finding that I had just heard from a pediatric doctor that I train with is that they also measured baby's nervous system in response to dad. So if dad enters the room in a stress state, not only does that affect mom who's sitting on the couch, but it also affects baby in that moment. On the flip side, the more robust mom's nervous system is, the more resilient it is, the better dad can enter the room in a happy, grounded, peaceful, more connected state. All those things trickle into baby in a positive way as well. So, heart rate variability is this scan that gives an overall summary of how mom's nervous system state is doing. So, you can see on this chart here, this green box or this green circle is ideal. Mild, moderate, severe are the yellow, orange, and the red. And then the white dot is where this person happened to land. Ultimately, the more this white dot is into the green, the more resiliency we see in that mom's nervous system. So, this is one of the tests that we love to do with moms when they first come in the office. We often find that they might be stuck in more of a sympathetic fight flight state. Their dot might be down lower, meaning that their battery is drained. So, not only during pregnancy might they feel more stressed, more worried, more nervous, more anxious, but they're going to have less charge to their battery, meaning they're going to fatigue easier, not be able to get things done during the day, not be able to keep up with all the things on their plate. And ultimately, we want mom's nervous system as charged up as possible, this white dot as close to the green as possible when baby comes, because we know now that's going to be a whole nother realm of things to do, another person to care for, and a whole nother thing that can use stress energy. So the more charged mom's battery is before baby comes, the better outcome we see with bonding, with connection, with baby's health and mom's health going forward. So I recommend you take a look at a pediatric or neurologically based chiropractic office. And if you are pregnant and you're looking for that test specifically, ask your office if they have it. And if they don't, reach out to an office that does to really give you that benchmark to know you're doing the best you can, not only for yourself, but for your baby as well.